Hello everyone, I am Dr. Mahalakshmi, educator, forensic medicine and toxicology. Now in this video, we are going to see about thermal injuries. Thermal injury, especially burn injury, it is a very important topic in case of university exam. We will see about that. So when we say thermal injuries, in this chapter, we will be seeing about lot of things. So first is your dry heat burns. That is the normal burn that we usually experience. We will see about this. Then we will be seeing about scald, that is burns by hot liquid. We will also be seeing this. Then you have chemical burns, burns caused by chemical substances we will be seeing here. Then electrocution, lightning and explosion. All these will be covered under these thermal injuries. So basically, what is a burn injury? So burn injury means it is an injury that happens because of application of heat. Because of application of heat. So this is what a burn injury is. And this heat, it may be produced by these dry heat, that is the burning up of any carbonized item, that or it can be caused by any hot liquid, that is your scald, or it can be caused by any chemical, that is your chemical burns, or it can be due to electrocution, lightning or explosion, that is your bombs. So everything, all the thing that you get because of the application of heat, we call it as burn. So this is the definition of your burn injury. And in this burn injury, the most important is this dry heat burns. So starting with the dry heat burns, what we have to know here is the classification of burns. So this classification, it is very important for practical and exam purpose. So they will ask you how will you classify the burns. There are lot of classification, but the most important classification is Dupenter. So Dupenter classification, and you have Wilson and Hebra. So these are the two important classification that is commonly used, and clinically what we use is this Dupenter's classification. So according to this Dupenter classification, you get first degree. So first degree, here there will be only redness, no other changes except for redness. Then you have your second degree, where you will get only blister and redness. So when the epidermis is involved, only the epidermis is involved, you will get these, either redness or redness along with blister formation. So these are the first two degrees. First degree, only redness. Second degree, redness along with blister. So these are the first two degrees of Dupenter's classification. So next is the involvement of the dermis. So you have the third degree, where the upper dermis is involved. So only upper dermis is involved. And next up we have the fourth degree, where the whole dermis is involved. So complete damage to the dermis, the whole dermis will be damaged, and in this you will have severe pain because of the involvement of the nerve endings. So nerve endings involvement, you will be getting these severe pain in the fourth degree Dupenter's burn injury. So first degree and second degree only epidermis, third and fourth you get dermis, then fifth is your muscle. So after your dermis you get muscular involvement. You will have charring of muscle. Then finally, sixth degree, if the burn injury reaches the bone. So if bone is damaged, then we call it as sixth degree. So this is the Dupenter's classification. You have 6 degrees, first 2 degree involve only the epidermis, third and fourth involve the dermis, and fourth is the most painful because of the involvement of the nerve endings. Then you have the 5th and 6th degree. In 5th degree you have muscular affected, and 6th degree you have the bone affected. So these are the Dupenter's classification. And Now you have the Wilson and Hebra. So first and second degree of Dupenter is Wilson and Hebra 1, and third and fourth is Wilson and Hebra 2. Fifth and sixth is Wilson and Hebra 3. So this is how the classification works, and commonly we use this. And when you explain a burn injury in case of postmortem report, when you are writing, you cannot directly say that we saw a third degree injury, burn injury, fourth degree burn injury, like that you cannot explain, because it is mostly in a transition phase. So you have to explain that it is third to fourth degree burn injury, it is fifth to sixth degree burn injury. So it will not be clear cut, only dermis is involved, only muscle is involved. We cannot say like that. In few places only muscle will be involved, in few places along with that bone will be involved. So you have to say it is fifth to sixth degree, like that we usually write in the PM report. So this is the main classification. The main thing you have to remember is this: first and second degree you will mainly see redness and blister. So this is the classification of the burn injury. Now in case of burn injury, apart from the classification, apart from the severity degree, we also have to know the surface area, estimation of surface area of burns. That is also very important. So in case of adults, we usually use a rule of 9. So rule of 9 is used in case of adults, and this is the rule of Wallace. So this is very important. What happens is that you get the 9% area, right? So here you get 9% in front, 9% in front, 9% over the back. So you get totally 9% area. Then you get the arms 9%, 9%. Here front of the leg 9 and back of the leg 9. So totally till now you have got like 1, 2, 3, 4, 8. Then you have the head and neck, which is another 9%. So here, so you get the 11 nines, and perineum is 1%. So this is the rule of 9. Front is 9, back is 9. The arm is 9, 9 each, and in case of leg you get 18 front and 18 back, 9, 9, 4 nines you will be getting, and head and neck is another 9. So finally 1% is for the perineum. You just remember you will be getting 11 nines, and area like which is bigger, having more surface area, you will be giving lot of 9s. So this is the rule of 9 or Wallace rule, which is commonly used. And there is another rule that we use in case of children, that is known as Lund and Browder chart. So this is what we use in case of children. This is more accurate than the usage of rule of 9 in adults. Why? Because the children, they will have different body structure. Here the surface area would be more different than the adult surface area distribution. So because of that we use this London Broad chart in case of the children cases. So using these two, we will classify the severity and the area of burns. So after finding these out, the most important thing that we have to know is area, surface area affected is more important than the severity. Like if a patient is coming with the 5th to 6th degree burns in 10% area, and another person if he is coming with 2nd to 3rd degree burns in 90% of area, then among these two he is having poor prognosis. The person with more surface area involved will always have a poor prognosis when compared to a patient with more severe burns. So mainly in case of burns, what will happen? You will have everything going out of the skin, right? So all the electrolyte imbalances, all the shock, hypovolemia, everything will happen when more surface area is involved. So, we have poor prognosis for somebody with more surface area involved than somebody with the more severe pain in less surface area. This is the important thing we have to know in this general part of the thermal injuries. Now, going to the main part of the burns, in case of this dry heat burns, the immediate cause of death and late cause of death is important, they will ask you. So, what is the immediate cause of death here is that it is primarily accidents. When people, if there is a burn, if there is a fire accident, people they will try to escape, and when they are trying to escape, they may fall over something or something will fall over them, like some big structure, some wooden structure, they will fall over the people and they will get injured because of that. So, that is the most common immediate cause. Apart from that, you also get neurogenic shock, and you will also get carbon monoxide poisoning. So, these are the reasons, these are the mechanisms how people die in case of a burn injury, either due to accidents or neurogenic shock or carbon monoxide poisoning. These are the immediate reasons. When we go to the late reasons why people die is mainly due to electrolyte abnormality. You have hypovolemia, hypovolemic shock. Then the most important, sepsis. People will go to septicemia and they will die. So, these are the immediate and late causes in case of burns. How people die in burns immediately due to accident, neurogenic shock or this carbon monoxide poisoning. Otherwise, if it is a late death, there will be electrolyte imbalance, hypovolemic shock and septicemia. So, this is how they usually go. And what are the PM appearance that is important in case of burns is that there are a lot of artifacts that are produced by heat, which will make us confused because burn is also one form where the body is disposed of. So, there are certain artifacts which is produced by the heat which will confuse us whether it is a case of antemortem drowning or postmortem drowning. So, we will see all about artifacts now. So, first such artifact is this. This is your pugilistic attitude, right? You have here this name. So, pugilistic attitude, also known as boxer's attitude or heat stiffening. So, this is the most important artifact that we usually see. So, what happens here is that because of the heat, extreme heat, there will be coagulation of muscle protein. So, all the muscle protein will coagulate, and because of that what will happen? This body, all the muscle will contract. So, muscle will contract and it will assume a all flexion posture. So, all the joints will go into flexion. So, everything will go into flexion means it is the boxer's attitude, right. So, elbow, everything will flex and they will look like they are trying to box. So, that is why it is known as boxer's attitude or pugilistic attitude. So, they will ask you what is the main mechanism. So, main mechanism is coagulation of muscular protein, and the features that you will be seeing is flexion, complete flexion of all the joints you will be seeing. And what are the condition that simulates this heat stiffening is that very common condition which is rigor mortis. So, it stimulates rigor mortis. But what happens in rigor mortis? There will be what? What is the change in rigor mortis? Here there will be depletion of ATP. Because of that you will get this kind of stiffening, which is different from this heat stiffening where the muscular protein coagulate, which results in the all flexor attitude. So, this is the first artifact that is seen because of the heat, and this heat stiffening, it is not a sign of antemortem burn, not a sign of antemortem burn, right. So, just because you see a stiffening, heat stiffening, that does not mean it is a case of antemortem burn. It could be either antemortem or postmortem, but we cannot confirm whether it is antemortem or not just by seeing at this heat stiffening. So, this is the first artifact. Then you will get to see this. This is your heat rupture. So, what happens here is that you see this area, this pale area. So, heat rupture means the splitting of muscle happens, splitting of muscles under extreme heat. So, when the body undergoes extreme stress, when there is extreme heat, what happens is that the skin will melt and the interior muscle, it will start to split. So, when it split, you will get to see this clear area surrounded by this charred area. So, once again, this is an artifact and this is also not a sign of antemortem burns. Means it cannot be used to differentiate antemortem or postmortem burns. Clear? So, this is heat rupture. Now, this heat rupture, it is usually confused with one other entity, that is your lacerated wound. So, mainly the difference between these two we will see. So, first heat rupture, it is due to extreme heat. So, in case of burn heat, you will be seeing this heat rupture. But lacerated wound, it will be due to some mechanical injury. And which type of mechanical injury? Either blunt or sharp. So, this is usually due to blunt force trauma. And what is the site that is usually seen? Heat rupture, it is usually seen over burnt regions. Areas with heavy burns, you will be seeing this. While in case of lacerated wound, it can be seen anywhere. And bleeding, it will be completely absent in case of rupture and it will be present in case of lacerated wound, because every blood vessel, everything will be crushed in case of laceration, while in case of heat rupture, it will merely split and all the blood vessel, nerve, everything will be just seen over the floor. It will not be damaged, and margin there will be burns only and you will not see any abrasion or contusion. But in case of laceration, there will be marginal abrasion and contusion. It will be definitely seen in all case of lacerated wound. And floor, when you look at the floor of the injury here, you will get to see intact blood vessels and nerves. But here everything, all the blood vessel, nerves, muscle, everything will be crushed. So, this is how the floor usually look like in a case of lacerated wound. And associated findings, there will be burns present. Here there will be some other mechanical injuries. Usually you will be getting to see mechanical injuries. Here you will be getting to see the thermal injury, that is your burn. So, this is the main difference between a heat rupture and a lacerated wound. So, heat rupture, it is an artifact caused due to extreme heat which splits the muscle. So, it will look like this pale region over the burnt area, and here all the blood vessels, nerves, everything will be intact. There will not be any bleeding or any sort of mechanical injury present in this heat rupture. So, with this we have done two artifacts. Next, what we have is another artifact, that is this heat hematoma. So, this heat hematoma, what happens is that when there is extreme heat, there will be boiling of blood in the diploveins of skull. So, in the venous system of the skull, what happens is when there is extreme heat, this blood will start to boil, which will result in a honeycomb shaped hematoma. So, this will result in a crumbly honeycomb shaped hematoma over the dura. And this heat hematoma, this is also not a surest sign of antemortem drowning. It is also not a surest sign of antemortem burns. So, the main thing about here is that this heat hematoma, it is always confused with an extradural hematoma. So, this heat hematoma, it will simulate an extradural hematoma, and this we have to differentiate by looking at this honeycomb like structure. So, when it looks like this crumbly honeycomb like structure, we can say that it is a case of heat hematoma. When it is looking like perfect sheet like this, then it can be said that it is a case of extradural hematoma. So, this is how you differentiate. So, 3 artifacts we have seen. Apart from that, you have another artifact, that is heat fracture. We have heat fracture. This heat fracture, because of extreme heat and pulling up of the muscles, there will be fracture of the bones, that is known as heat fracture, also known as avenue fracture. So, these are the artifacts, and all these artifacts does not help us to differentiate an antemortem and a postmortem burns. This is how it usually looks like under extreme heat conditions. So, these are the normal artifacts that you usually see. So, if you want to see what are the surest sign of antemortem burns, you have to look at these internal findings first. So, this internal finding, one important finding is the presence of soot beyond bifurcation of trachea. So, this black color soot deposition beyond the bifurcation of trachea, it is an important antemortem burns sign, right. So, this is a very, very important sign. Apart from that, you will also get to see presence of blisters with high protein and chloride content. This is also one important antemortem sign of burns. And enzymes, all the vital enzymes, it will be elevated. Then carboxyhemoglobin level will also be elevated. So, these are the signs of antemortem burns. And externally, you will get to see one more important sign, that is line of redness along the border of burns. If you see any burn injury, if you look at the border where the normal skin meets the burn injury, you will get to see one line of redness. See, do you see this here? Here, this redness. This is the line of redness, and this is present only in case of antemortem burns. So, by looking at all these features, this soot deposition, this blister formation, enzyme levels, carboxyhemoglobin levels, and line of redness along the border of the burn injury, you can say whether it is a case of antemortem burn or postmortem burns. So, normally when they ask you about burn injury, they will ask you about the classification. They will ask you about the estimation of surface area, what is used in adults and what is used in children. And if they were to ask some more thing, they will be asking about these heat artifacts, that is your heat stiffening or pugilistic attitude, then the heat hematoma, heat rupture, and this heat fracture. All these things they will ask, and the most important thing will be the surest sign of antemortem burns, which is these 5 points. These are important thing when they ask about dry heat. So, next to that you will be seeing the scald. So, this is scald. So, scald, what will happen is that there are main feature that we have to know in scald. First is the singeing of hair, that is this. Do you see this dark color hair? That is a singed hair, that is a burnt hair. This singeing of hair and carbonization or soot deposition, these features are absent in case of scald. These are present only in case of these dry heat injuries, that is dry burns. Why? Because scald is mainly due to hot liquid. So this hot liquid, what it will cause is there will be bleaching, there will be soddening, there will be blisters. Only these will be present. So vesicles or blisters will be present. So these are the features that is usually seen in this hot liquids, not the singeing of hair or soot deposition. So if they give a case scenario that there is a burn injury but there is no singeing of hair, then you have to immediately think about the hot liquids. So this hot liquid injury, we called it as scald, and this is how it usually looks like. All over the burns you will be getting to see this blister. Here all the blisters have burst, so you are not seeing the blister, but this is how a scald will look like. Like if you ever had an injury while cooking, when there is a splash of oil, you will definitely get these kind of scald, which usually comes with the blister, and later on the blister will break off and you will be getting to see this raw skin. So this is how the scald usually looks like. And the main differences between this dry heat, scald and chemical burns, it is usually asked. So dry heat, it is caused by burns, and scald, it is caused by hot liquid burns. And chemical burns, this is due to some chemical substances. And what is the site? The site means like at the point of contact, when you come in contact with fire, that point and above that, you will be getting to see these burns. So because flame will go up, right? So because of that, you will get to see burns at the point of contact and above the point of contact. But in case of scald, what will happen is that you will get to see at the point and beneath. So it is a liquid, it will trickle down, right? So it will go towards the gravity. So it will trickle down and you will get to see at the point of contact and beneath the point of contact. And chemical burn also same as a liquid. You will get to see the at the point and beneath the point of the contact. And splashing and trickling, it is not seen in case of dry heat, but it is seen in case of, this is seen in case of this chemical burn and scald. And charring, it is present in case of dry heat, absent in case of hot liquids, and it is like depending upon the substance used, it may or may not be present in case of chemical burns. And singeing is present in case of this and absent in both chemical burn and this hot liquid scald. And ulceration, it is absent here and present in case of this. Apart from that, you will also getting to see bleached, soddened appearance in case of these liquid burns. So this is the main difference. If they give a case scenario or if they give you a photo and they ask you to differentiate whether it is a dry heat or scald or chemical burn, depending upon these features, you can differentiate all the burn injury. So this is the main difference between these burns. So in case of burn injury, the main thing that we have to remember is the heat artifact and the differences between the dry heat, scald and chemical burns. If they ask you singeing is absent in which burn, you have to say it is absent in scald and chemical burns. Charring and carbonization or soot is present in scald or not, it means it is not present in scald. So this is how the questions are usually asked. And apart from that, if they ask you to write about the postmortem finding usually seen in the burn injury, you can write all the heat artifacts. Apart from that, you can write this singeing of hair, carbonization or soot deposition, and in case of face, you will get to see something known as crow feet appearance due to presence of the soot. So all these things, it is usually seen in the postmortem finding of burn injury. Next to this thermal injury, we are going to see another entity in thermal injury, that is electrocution. So basically in electrocution, there will be passage of current. So, current will pass through your body and you will get certain thermal injury and eventually death. So, this is what electrocution is. And in case of electrocution, you get two types of current. You get alternate current and direct current. And between these two, this AC is very, very dangerous. And usually when we say high voltage setting and low voltage setting. So, what we usually have at home is the low voltage setting. In case of industries or these power station, what they have is this high voltage setting. And these high voltage and low voltage setting, the cause of death differs. In case of high voltage setting, it is mostly due to respiratory center depression. And low voltage setting, the cause of death is mainly because of the cardiac arrest, like cardiac arrhythmia. This is how these two differs. But when you compare voltage versus current, that is voltage versus ampere, it is ampere that is more dangerous. If you have high voltage and low ampere, the damage will be less than a low voltage with high ampere setting. So, this ampere is more important than voltage in case of this electrocution setting. And usually in case of this electrocution death, what happens is that you will get to see this entry and exit mark. So, this entry and exit mark, it is usually seen where there is resistance offered. If the pathway of the current is offered any resistant, so if there is any resistance, then you will get to see this entry and exit mark. If it is present, then it is the surest sign of electrocution. If it is absent, then we cannot rule out electrocution, but looking at the circumstances, we can conclude that it is a case of electrocution. But if it is present, then it is surely a case of electrocution death. And this entry and exit mark, they are usually seen in the palms and soles. So, this is where it is usually seen because this is where maximum resistance is offered. And this entry and exit mark will not be seen if there is no resistance, like there is presence of wet fingers. If wet fingers is used to switch on light or something and current passes through that, there will be no resistance. Under such circumstances, there will not be any exit or entry marks. Or if the point of entry is through large surface area, if the current enters your body through a large surface area, then also you will not be able to see this entry and exit marks. And looking into this entry and exit mark further, we have to know two things. First is Joule burn or endogenous burn. So, this is a type of entry wound. So, this is a type of entry wound and this is seen in low voltage setting. This is seen only in low voltage setting and it forms a typical crater appearance. So, if crater appearance of electrical entry mark is seen, then you can say it is a case of low voltage setting. And this crater appearance, how it would look like? It is a shallow crater with pale center and blanched peripheries. All the border, it will be blanched. This is how these Joule burn or endogenous burn looks like. So, why we call it endogenous burn is that here the current will enter the body and heat is produced inside the body. So, heat is produced inside the body which results in this burn injury. That is why we call it as an endogenous burn. Now, you have another type of burn which is known as exogenous burn, or crocodile burn. So, here what happens is that it is usually seen in a high voltage setting. So, this is usually seen in a high voltage setting And here what happens is that the burn is formed outside. Outside itself there will be a fire, there will be spark of fire, and that fire it will come and hit your body, and that will result in this burn. So this is why it is known as exogenous burn. And since the fire is forming from outside and also it is a high voltage setting, the intensity of that burn will be more, and that burn it will cause the keratin coagulation. It will cook up all the keratin. Because of that, you will get a crocodile skin like appearance. Crocodile skin like appearance. So all the keratin it will coagulate and become a plaque. So keratin plaques will form. So this will look like a crocodile skin. That is why we call it as a crocodile burn. It is also known as spark burn. Why? Because since the current is arcing over the air and touching your body, causing a burn through these sparks, it is known as spark burn. So this is due to the arcing of current. We call it as spark burn. So when the low voltage setting causes heat to be produced inside your body, we call it as Joule's burn or endogenous burn. If the heat is producing from outside and causing the injury on your body, we call it as exogenous burn. And crocodile burn if the keratin coagulation happens and keratin plaque forms over your skin. And when there is arcing of current in the ear, we call it a spark burn. So these are the main two types of entry wound that is usually seen. Apart from that, if the conductor is linear, you will get to see a linear burn usually over the fingers. It will be seen a linear burn injury. So these are the entry wounds that is usually seen. Apart from that, you will get to see this exit wounds. So exit wounds, what happens is that they will be usually more large and more damage will be seen. So from the entry wound, exit wound, it will be more large and more damage will be seen. So this is the main external finding that you will be looking for in case of an electrocution death. So endogenous wound seen in low voltage setting, exogenous burn seen in high voltage setting. It is also known as crocodile burns, and spark burn is also seen. So this is the external finding. Next, coming to the internal finding, what you will mainly see is there will be petechiae along the pathway of current. So along pathway of current, you will be seeing petechial hemorrhage. So this is main. Apart from that, you will get to see Zenker degeneration of muscle. When current pass through the muscle, you will get to see something known as Zenker degeneration of muscle, and you will also get to see bone pearls. So this bone pearls is also seen in electrocution death. So internal findings, these three mainly: petechiae along pathway of the current, Zenker degeneration of muscle, then bone pearls. So these are the main internal findings, and external findings, the entry mark and exit mark. Sometimes what happens is that only based upon the history, we will be able to identify certain electrocution cases. They will come to you with no entry or exit marks. They will only give you the history. And what you have to do in such cases is that you have to do complete autopsy, ruling out all other possible causes, be it a pathological cause or any other suspicious causes. All the causes you have to rule out, and only after ruling out everything, you can determine the cause of death as electrocution. Till that, you cannot simply say electrocution is the cause of death without seeing this entry or exit mark. If you are seeing entry or exit mark, it is fine. You can say that it is a case of electrocution. Since I am seeing this Joule burn, since I am seeing this spark burn, I am saying that it is a case of electrocution, like that. But without seeing these, you cannot confirm before excluding all other cases. So this is how electrocution normally comes. And in electrocution, they mainly ask you about this high voltage and low voltage setting, and which is more like dangerous, voltage, ampere, AC, DC, like that they will be asking the questions. So up next, what we have is lightning burns. So, lightning burns, it is also a thermal injury, and in lightning burn you will get these arborescent burn, which is very classical and typical of these lightning injuries. So, this arborescent burn, it is seen over the arms and chest and shoulder. This is where it is usually seen, over the back also, and they are very fine, irregular, superficial, fern-like structure. So, these arborescent burn, this is very typical. They will give you a picture and they will ask you what is the reason for this injury, what is the name of the injury, they will ask you. So, it is usually seen over the shoulder and back, mostly over the upper torso it is usually seen. And the exact mechanism, there are multiple mechanisms, but nothing is confirmatory. It is not confirmatory. They used to say that it is travelling along the pathway of the blood vessels, and because of that blood vessel is getting stained, like that they used to say, but that is also not confirmed. The exact mechanism is not known for the arborescent burns. And the differential diagnosis of this is that marbling. So, marbling is one important differential diagnosis for this arborescent burn, and this disappearance, it will disappear after some time, but this marbling, it will stay on till decomposition completely destroys the body. And what are the other injuries that is seen with lightning is that mainly lightning causes injury by mechanical dispersion of air, that is your blast wave, or through electrical injury. So, these are the two ways by which a lightning can cause injury, either by blast wave, that is a pressurized air will come and hit. Because of that there will be blunt trauma to the organs. This is one mechanism. Other mechanism is electrical injury. Like your electrocution, it can come and directly hit you. So, directly hit or side hit or through the ground. It will spread and it will reach you, or like it can cause burns, like it can create fire, will cause burn to you. So, this electrical injury and blast wave is the main mechanism through which lightning causes injury. So, based upon which thing happened, you will be getting to see the postmortem feature. If it is a blast wave, you will be getting to see trauma to the internal organs, and sometimes even your dress will be torn. And if there is any metallic object kept, like your coin, in the pocket, they will melt. So, all these findings are seen in case of lightning. And if it is an electrical injury, you will be getting to see an entry and exit mark. And if it is a burn, you will be getting to see the exogenous burn injury in case of the lightning death. So, this is the important postmortem finding that you will be seeing in the lightning death. Then, in the thermal injury, there is one more thing, that is blast injury, that is due to bomb explosion. So, explosion of bomb, which will result in these thermal injuries. So, what happens is that in case of bomb explosion, we mainly get 4 types of injury, that is primary, secondary, tertiary and quaternary. So, here what happens is that when a bomb explodes, firstly there will be a blast wave. So, blast wave will come out of that explosion. So, this is the primary thing that will cause all the issues, and this blast wave injury, it is known as primary blast injury. So, when this blast wave, that is your compressed or pressurized air. So, pressurized air will come and hit you, that will cause certain injuries in your body, that is known as primary blast injury. Next to that, what we have is secondary blast injury. This is mainly due to the propellant, like a small missile, like small things that is coming out of the bomb, like a sharp object that will lead to some abrasion or laceration. All those things will be coming under this secondary blast injury. Then quaternary is when this blast wave pushes you to hit something, like it will throw you away, you will go and hit some masonry, you will go and hit some wall, ground or something, and because of that hit you will be sustaining some mechanical trauma. That is the tertiary blast injury. And finally you have the quaternary blast, where you will experience injury due to the burns or toxic gases that is coming out of the blast. So these are the 4 classification of the blast injury. This is where all the injuries coming under. So when we look at each and everything, so first, primary blast injury, what happens is that here mainly you have the blast wave. So this is basically a pressurized air, right? So this air will come and hit you, and where it will cause damage is that wherever there is air-water interface, there you will be getting the damages. So where are air-water interfaces there? Mainly your lungs, ear, then intestines. This is where the main injury will occur. This is the primary blast injury. Then next to that you have the secondary injury. So in case of secondary injury, there you will be getting the missiles. So they will come and hit you. Because of that you will get something known as Marshall's triad, which is abrasion, contusion and puncture, laceration. So these are the types of injury that you will be getting in this secondary blast injury. So this is known as Marshall triad, and what is consisting of Marshall triad, that is important: abrasion, contusion and puncture, laceration. Then we have the third, tertiary injury, which is mainly due to masonry. So when there is falling masonry or when you go hit ground, you will get. So here you will be mainly getting mechanical trauma. Because of the blunt force you will be getting the trauma like fracture and all. So this is the tertiary blast injury. Then finally your quaternary blast injury, you will be mainly getting burns. So this is where the explosion injury stands. So this is how the explosion injury will look. Primary injury mainly due to the blast wave, secondary injury mainly due to the missiles, tertiary injury due to the masonry causing mechanical trauma, and quaternary due to the burns and toxic gases. Now there is something known as solid blast. So solid blast is when the blast wave travels through solid items. Like it will pass through some wall, it will pass through some floor, like that. It will pass through some solid items, that is solid blast. Here what happens is that the damage, it is usually done to the spine, your lower vertebra and foot. This is where the primary damage happens. And next up what we have is underwater blast. So here what happens is that the blast will happen under the water. Here which organ primarily damages is your abdomen. If head is above water, and if the head is below water, it is ear. So if head is below water, it is ear. So this is how the underwater blast will cause injury to your body. Generally, if there is a blast wave through a air, blast air comes and it will cause damage to your ear, lungs and intestine. And if it is an underwater blast, if the body head is above the water and body is beneath the water, intestine is affected because lung is protected by your rib cage. If the head is beneath the water, then the ear is affected because ear is more sensitive to these blast wave. So this is how the explosion injuries look like. So with this we are finishing the thermal injuries. In the thermal injury, the main thing that we have to remember is the dry heat. So, dry heat, what are the heat artifacts that is usually seen? The heat rupture, heat stiffening, heat hematoma, everything. What are the antemortem sign of burns? That is the line of redness, presence of soot beyond the bifurcation of trachea, presence of high chlorine and protein content in the blister, presence of increased vital enzymes, then presence of elevated carboxyhemoglobin level. So, this is very, very important in case of this dry heat, and in case of singeing, there will be, in case of scar, there will be absence of singeing, and finally, this electrocution, where the entry and exit marks, how it will look like, which is seen in low voltage setting, that is your Joule burn or endogenous burn, exogenous burn, which is seen in high voltage setting. Then electrocution, you have the lightning form where you will get the arborescent worm. Finally, you have the explosion injury where you will have the blast wave coming and hitting the air-lung interface. So, with this we are completing this. Thank you for watching.